Hey everyone, my name is Dr. Galatia Strong. After getting 100% on my NPTE, I co-founded SPT with me, designed to help DPT students who are about to take their NPTE actually understand content versus just trying to memorize everything. If you find this content helpful, check us out at sptwithme.com for our 3 and 6 hour course to help you pass your NPTE. Now onto what you're actually here for, let's talk about balance strategies. Within this video, the balance strategy that we'll be talking about is specific to reactive balance strategy. So recall the difference between reactive balance and anticipatory balance. Anticipatory balance is like you're being thrown a basketball and you intentionally have to activate certain muscles to be able to go and grab it exactly where it's being thrown. Reactive balance is like you're walking or you're standing and there happens to be an earthquake going on and the floor is moving under you, so you have to react to these perturbations that are throwing your balance off. Reactive balance is where you cannot anticipate how your balance is going to be thrown off. If that were to happen, these are the 3 strategies that humans can use to make sure that our balance is maintained and we avoid falling. So the strategies that come from movements, the strategies come from movements of the ankle, the hip, and if the force is large enough and our center of mass is moved far enough or displaced, we actually need to take a step forward, which is called the step strategy. Let's start off with the left side. So we're talking about the ankle strategy. Remember that this can be done while you're standing, while you're walking. Now, as always, to really understand how concepts work, you have to put yourself into the situation, or at least have someone else do it so that you can imagine, what that person's going through. So let's say that you're standing. It's a windy day and the wind is just strong enough to nudge you a bit, right? We're just being nudged. It's not a storm. Every single time that this wind nudges you, are you going to expend a lot of energy just to take a step forward or backwards to compensate for that nudge, right? No, probably not. All you'll probably do is just rock back and forth. Your torso is straight, your knees maintain to be straight, hips are straight, and really the only thing that's keeping you up is your ankles. So really you're just fluctuating between the use of your dorsiflexors and your plantar flexors to be able to maintain your center of gravity over your base of support. So next let's talk about the hip strategy. This happens when the force that throws off our center of mass is greater than that of what's required to use the ankle strategy, but less than that of what is required to use the step strategy. So as an example, think about, you're walking on the street or the sidewalk and all of a sudden you look at the floor and you see a snail on the floor. So for me, I don't want to step on that snail. So, you think about you're gaining some momentum and all of a sudden, oh shoot. So my chest is over my base of support and my arms are probably flailing all over the place, and this whole time my hip extensors are doing the work in hopes to bring my center of mass back over my base of support, and eventually it does. This is the hip strategy. So just note that in this hip strategy, our ankles are still working, but it's not like your calves are just completely flaccid, but the main thing that's being used to be able to bring your center of mass back is your hips. In this case, your ankle strategy just is not enough to be able to compensate for the center of mass that has been displaced over your base of support. Lastly, let's talk about this step strategy. So this is going to be used when the force is too great for both the ankle strategy or the hip strategy alone. So situation, think about a severe windstorm. You're walking in it or you're just standing in it. Whether you've actually been in one yourself or at least have seen the news, you're going to notice that people are being physically pushed by the wind, and in order to not fall, they are taking a step forward or taking a step back in response to this wind perturbation. Another example could be, you're Black Friday shopping or you're at a concert and people are just bumping into you left or right, forward, backwards. If you were just to rely on the ankle strategy, your whole body is completely straight, you're probably going to face plant into the floor. The force is just way too much. Same thing with the hip strategy. If you're just trying to bend with your hips and not actually move with the crowd, you're also going to go down because your feet are planted. So we have to move with that force by taking a step so that we don't fall down. So why does this matter? Well, for a person who's agile, this comes naturally, right? We don't really need to practice this, and that's because our reflexes are working well, our muscles are strong enough, our joint mobility and range of motion to these respective regions are within functional limits. But who this does matter for are patients who are at a fall risk. Just think in your own life. Think about a person that has the worst balance you have ever seen, family member, patient, whoever it is. Think about them using an assistive device, or do they look like they're going to fall or trip any second if they're not using one? If you were to go behind this person and just shove them forward, would they fall? Probably yes, right? If not, think about shoving them even harder. Would they fall now? Yeah, the idea is this person's gonna fall, okay? So how do we help them? We can practice these strategies. You know, with pretty much everything in physical therapy, if you find the impairment, then you address it by doing it. Now, if that's too intense to do, then maybe regress the activity a little bit. But the idea is you have an impairment, you're going to thus improve on that impairment. Now, for this particular person that you're thinking about, what is it that's limiting them from performing the ankle strategy, the hip strategy, or the step strategy? Is it joint mobility deficit? Is it flexibility? Is it strength, etc.? Have they not done something similar to these movements in a while, right? Whatever you don't use, you lose. With balance, you can retrain it. Or maybe not necessarily retrain, but even just train, right? If you get someone to practice this, and you know they might get into a situation where they have to have these reactive balance strategies, and that's going to come in handy, you know, you'll have helped them with decreasing their chances of falling. Now, unfortunately, we can't always get people fall proof, but at least we can help them with these kind of things by identifying what their deficit is. Now, just keep in mind that even though, yes, we can definitely help with patients with their reactive balance skills, whichever strategy it might be that they're having a deficit in, just keep in mind that not everyone has to practice every single one of these or even any of these at all. You know, it might not really be a goal for them. So let's say, you know, a person is mainly a household ambulator, they feel safe, they have grab bars, they use a walker, you know, they don't really go into situations where they're going to have perturbations. Of course, you never, you know, you can't expect the unexpected, that kind of thing. But you know, you kind of have to gauge what the purpose of your treatment is. Why force them to do something that's never going to happen per se? Now, one final thing, just note that these strategies are in the sagittal plane, just in the anterior and posterior direction. Now, of course, balance does not happen unidirectionally. If a person pushes someone from the side or the wind pushes someone from the side, then we have to be able to react. And honestly, in very similar ways as ones that we've already talked about. So it's not just the sagittal plane, it can be the frontal plane. But the reason that we care about these three is just that the sagittal plane movements, they are the most common balance strategies that we want to address. All right, not talking about balance strategies anymore. I wanted to give a shout out to Scholarnetics 360. You know, whether you're a first year, a second year, or third year student, you know, maybe you're starting your NPTE studying, think about a mentor, right? Mentors are incredibly helpful to guide you in the right direction. You know, as much as we can read notes, reread our lectures, watch videos, being in the real world is completely different from our textbook education. It just is. Scholarnetics 360 is a program that can connect you to physical therapists nationwide. You can get private sessions with someone that you click with. And it really is just a great asset for anyone, regardless of whether you feel like you're struggling in school or not. I have personally chatted with one of the co-owners, Dr. Edgar Garavito. He's a super nice guy, and he's really doing this with the intention in hopes to build connections with everyone and build a better physical therapy community. So check it out at scholarnetics.com. So on to NPTE prep course resources. As you know, SVT with me is an NPTE prep course platform. So if you enjoy watching videos and having someone lecture, hopefully you choose this platform. Otherwise, if you're looking for some mock test questions, practice test questions, check out typicalpt.com. I personally review their question bank myself, and there are a ton of questions. They also provide some really cool analytics that they give you at the very end to help you identify what you may not be doing the best in. But check them out at typicalpt.com. As always, I'm hoping that you enjoyed this video. I hope it kind of cleared up reactive balance strategies, just 3 simple ones: ankle, step, and hip strategies. Here's a reference that I use, very helpful if you want to look into it. Stay tuned for more.